Alrighty, we're about to start our second case of the day. This is a very special patient all the way from Kentucky. He's built like a bulldog. He's like 300 pounds, and like if I was a running back and he was a linebacker, I just go, here's the ball, please take it. I'll sit down right here with one knee. If you look at his x-rays, he's had previous microdiscectomies and laminectomies at 3, 4, and 4, 5, right there and right there. He's got a little bit of asymmetric disc collapse, and if you can see, he's got a focal kyphosis between 4 and 5. It doesn't move much on flexion extension views, but he's got a ton of back pain, recurrent radiculitis and stenosis. So after some deliberation, we decided to fix everything all at once via a minimally invasive TLIF technique that will decompress the nerves, realign the spine, and stabilize the spine. It will require a fusion, but if we do it minimally invasively, the upper levels and the lower levels will be protected by the functioning muscles. If you do not have that, that's when you get adjacent level degeneration. Anyway, we're all hoping for a great result because he has to go back to Kentucky and tell everybody that he flew all the way to San Diego to have his surgery. And he doesn't say anything other than, I had such a great result, it was such an awesome trip, I will eat my hat. So let's get going. Making the incisions. This is probably going to be one of the deepest back wounds in a while. But we still love you. I just may be very cranky by the end of the case. And look at how much cheating is involved with the navigation. I feel so guilty, but you know what my mama always said? You're gonna cheat every once in a while, you ain't trying hard enough. I'm just rotating, shaving this thing. It's cheating, I know. But this is how you get the bones to fuse. To do a really good facet fusion and release. Hold on for a second, somebody. Bone graft. Oh, deep. Alrighty, making the tracks for the screws. Your bone is rock hard. Good job. These screws are going to be absolutely rock solid. Very good bone. Must be all that Tennessee living or Kentucky living. Woohoo! Oh! Oh! It's a two-handed operation, it looks like. Can you hold that right there? I pity the fool that has to take that screw out, if ever. Probably. There we go. Look at the left lower hand image. Yep. Normally I can just get a feel for it, but it's tight all the way down. Alrighty, making my way down there despite the forces of evil. Don't tell the hospital, but this is the sexiest cage alive, also the most expensive. But you came here to get a Rolls Royce, and that's what you're going to get. It's called Sable. And if I had to have an MIS TLIF, I wouldn't let anybody do it without Sable, because this implant makes all the difference in the world. You'll see in 2 seconds. Thank you, Deborah. That's our neuromonitoring person telling me to be quiet. No. So that is what she's supposed to do. Tell me that there's neural activity, so I can make sure everything looks okay, and it does. Just chipping away at the stone, basically taking gum out of shag carpet when the shag carpet is like a priceless family heirloom. You can't injure one thread of it. That's basically what I'm dealing with, if you're into that sort of kind of projects. Beautiful, sexy, really, really expensive, perfect cage going in. This is the 4-5 level. This is the one that was kyphotic and really stiff and the most cockapoo of all the levels. So I did a lot more work on this level. Let's see if it makes a difference. You be quiet. No, I'm kidding. That's Deborah telling us that the neuromonitoring signals are quiet. Okay, wag back in. Let's take a pretty x-ray. Let's get the... Ooh, yeah. It's getting bigger. Oh, that is so sexy! Lateral. You still did the nadir maneuver. I don't know. Anthony's been practicing the nadir spin, so you got some competition. Yeah, he doesn't do it as sexy as you, but don't tell him I said that. You got that little twirl at the end. That makes it sexy. Can you lower your machine or, yeah. Can you raise the bed up just a...
How'd the kids go, Dr. Kim?
It went perfectly. I'm going to go home and take a jacuzzi though, because yeah, this was deep. There's a lot of work, and these delicate Asian fingers took a bit of a beating. But I'm so happy. I can't wait for you to see your x-rays. And I bet you're going to feel taller too. So best wishes for a speedy recovery.